Hello and welcome to Progressive Education Society's Modern College of Pharmacy, Nigri, Pune.
Hello, myself Dr. Bhushan Pimple. In this video, we will discuss about the toxicity and drug interactions of Digitalis, Ephedra, Amla, Ginseng and Turmeric. First, let us have a look at Digitalis. Digitalis is generally consumed as fresh or dried leaves of Digitalis purpurea or Digitalis lanata belonging to family Scrofulariaceae. Sometimes the extracts and the isolated compounds have also been administered. The chief chemical constituents are digoxin, digitoxin, and digitoxygenin. All are cardiac glycosides. Major applications of these drug or the phytoconstituents is as a cardiotonic in the treatment of congestive heart failure. It can also be used as in the treatment of arrhythmia. Besides, it has been found to be a mild anti-inflammatory agent. Digitalis is associated with certain toxicities such as in case of CNS toxicities, drowsiness is the major toxicity. That means overconsumption of digitalis can lead to drowsiness, dizziness or headache. Certain GI complications involve abdominal pain, nausea, vomiting, diarrhea or unexplained weight loss. It also has cardiac side effects like palpitation or swelling of the extremities because of a retention of fluid in the extracellular region. Bradycardia and hypotension has also been observed in patients consuming digitalis for a chronic therapy. Therefore, it has to be consumed with precautions and generally should not be administered in pregnancy or breastfeeding because it is teratogenic and can pass through the milk in the babies. Patients suffering from kidney diseases or in which kidney is not functioning properly, in that case these patients should be avoided or they should not be given digitalis because kidney eliminates the digitalis of the body. Impaired kidney disease or impaired kidney can cause retention of this digitalis in the body leading to arrhythmia or sometimes increased drowsiness. Digitalis has various interactions with various drugs like digoxin itself and digitoxin. Many a times it happens that the uh, physician prescribes digitoxin or digitoxygenin for the treatment of congestive heart failure and simultaneously the patient visits alternative therapy or consumes alternative systems of medicine wherein again digitalis leaves or the decoction or extracts prepared from digitalis leaf are found to be consumed. Now in that case it causes synergistic effect thereby increasing the heart rate, force of contraction and blood pressure. It is very severe and it can cause toxicities such as cerebral hemorrhage. Quinidine is usually administered in patients suffering from arthritis as well as arrhythmia. Now, concomitant consumption of quinidine and digitalis can break the rhythm or can disturb the rhythm of the heart and again lead to arrhythmia. Diuretics, generally the chlorothiazide, chlorthalidone, furosemide or hydrochlorothiazide, these are the drugs that decrease the potassium level of the body. Now, digoxin requires potassium ions in order to function efficiently. But in low potassium level, the efficacy of digitalis is reduced. Therefore, potassium-sparing diuretics like amiloride or spironolactone should be administered, or these should be replaced. Stimulant drugs such as bisacodyl, cascara, or castor oil, senna, these decrease the potassium level as these are very strong purgatives or cathartics. So these should be replaced by bulk forming laxatives such as isabgol or methyl cellulose. Further, it has been observed that a particular class of antibiotic, that is macrolide antibiotics, they increase the absorption of digitalis, thereby aggravating the heart rate and force of contraction. This can lead to cerebral hemorrhage or increased blood pressure. Next drug is ephedra. Ephedra, as we all know, is obtained from dried young stems of Ephedra gerardiana, Ephedra equisetina, belonging to family Ephedraceae. The chief chemical constituents are ephedrine, norepinephrine, pseudoephedrine, and other aminoalkaloids. Generally, it is administered for the treatment of asthma, that is as a bronchodilator, cardiac stimulant, treatment of asthma and hay fever and other allergic disorders, then as a nasal decongestant. Ephedra has certain toxicities such as it increases the salivation, hyperactivity of a patient, then palpitation, myocardial infarction, and lethargy, that is failure to respond to a particular stimuli. Then it is also exhibited to show certain cardiac toxicities like hemorrhage, necrosis, and degeneration of the ventricles or interventricular septum. Therefore, it has to be judiciously used, and certain precautions like in patients suffering from chest pain or angina related chest pain, for them ephedra should be avoided as it can stimulate the heart and can worsen the chest pain. Besides, irregular heartbeat, that is arrhythmia, or person suffering from arrhythmia or long QT interval syndrome, it can further aggravate the condition. It also causes the disturbances or synergistic effect, or we can say aggravate the conditions related to high blood pressure or narrow angle glaucoma. Ephedra should not be consumed along with certain drugs as it leads to severe drug interactions. The examples are like QT interval prolonging drugs like amiodarone, dofetilide, procainamide, quinidine, sotalol, and thiorizidine. Combining ephedra with these drugs can cause cardiac arrest or angina. Methylxanthines generally have been found to interact with ephedra such as caffeine, theophylline and aminophylline. Combination causes jitteriness, that is nervousness, or it can also increase the anxiety, heart rate and blood pressure. Cardiac stimulants like diethylpropione, epinephrine, phentermine and pseudoephedrine increases the heart rate, blood pressure and anxiety by causing synergistic effect. Dexamethasone has been found to increase the rate of ephedra has been found to increase the rate of breakdown of dexamethasone, thereby reducing its efficacy. Certain ergot derivatives also interact with ephedra like bromocriptine, dihydroergotamine, and pergolide. Both are cardiac stimulant, therefore the heart rate and blood pressure increases. Also, it worsens the condition of anxiety. Generally, the medications used for treatment of depressions are MAO inhibitors, and Ephedra interacts with these MAO inhibitors like phenelzine and tranylcypromine. These are the cardiac stimulants and increase the heart rate. And next drug is Amla. Commonly it is known as Indian gooseberry, and it comprises of dried or fresh fruits of Embolica officinalis, also known as Phyllanthus embolica, belonging to family Phylanthaceae. Major chemical constituents are ascorbic acid, ellagic acid, gallic acid, and ambelicanine. The reason why amla is consumed is for its anti-diabetic, immunostimulant, treatment of constipation, and memory enhancer, and as an anti-aging agent. Amla has certain toxicities such as it increases the acidity of the stomach. Overconsumption of amla can further lead to constipation. In low doses, no doubt it is used for the treatment of constipation, but overconsumption further aggravates the situation and leads to constipation. It lowers the blood glucose level in diabetes, but the rate at which or the magnitude at which the blood glucose level is reduced is not controllable. It varies with individual. It lowers the blood pressure in hypotensive individuals also. So hypotensive individuals should be cautious about this. It reduces the weight. Even if you are not desiring to lose the weight, then also overconsumption of amla can reduce the weight and can worsen the bleeding. Therefore, it is contraindicated in certain situations such as hemophilia, wherein it prevents the platelet aggregation and can lead to heavy blood loss. Hypotensive individuals should avoid overconsumption of amla as it lowers the blood pressure. Same is the case with ulcer or individuals suffering from acidity and diabetes, as this can synergistically act with the anti-ulcer drugs, or sorry, increase the acidity and decrease the blood glucose level. Amla also exhibits drug interactions, although they are few, but they are major, like with anti-diabetic drugs, example, glimepiride, sitagliptin, glibenclamide, and many more, metformin and all. Since amla is hypoglycemic, both can cause synergistic effect and the patient may enter into hypoglycemic coma. Antihyperlipidemics like all the statins which are HMG-CoA reductase inhibitors. Amla also act in the same fashion and lower down the blood cholesterol level. Now this can be toxic or can be harmful in patients wherein the sex hormone production is lowered or vitamin D production is also minimized. So this can lead to further toxicities associated with sexual disorders or bone problem. Antidepressants or anti-epileptics, antibiotics and antifungals, all they amla increase their breakdown and decreases the efficacy of these drugs. So these are the major but few interactions associated with amla. Ginseng is another drug that has major applications, or it is routinely consumed not only in traditional systems but in as a nutraceutical as well. The biological source of ginseng is it comprises of dried roots of Panax ginseng in case of Korean ginseng and Panax noto ginseng in case of Chinese ginseng, both belonging to family Araliaceae. The chief chemical constituents are of ginsengoside class or panaxoside class And another important chemical constituent is damarol. The reason why it is consumed is for the treatment of Alzheimer's disease, mental function, in order to boost mental function, in order to treat erectile dysfunction and flu. Ginseng has various toxicities such as it causes nervousness, insomnia, changes in the blood pressure, pain in the breast and vagina, also bleeding associated with vagina, and vomiting and diarrhea. Major precautions while administering ginseng should be taken because it aggravates the autoimmune disorder conditions such as multiple sclerosis or rheumatoid arthritis or lupus erythematosus. These are the autoimmune disorders, and ginseng promotes the immune system, or it aggravates, or it stimulates the immune system and worsens these conditions. It also should be avoided in patients who have bleeding problems or diabetes and trouble in sleeping, that is, who are suffering from insomnia, or even in cases wherein organ transplantation is just carried out. It interacts with drugs such as alcohol. Alcohol is broken down immediately by ginseng. Caffeine, with caffeine, it increases the heart rate, blood pressure, and anxiety. With insulin, it decreases the blood glucose level and can make a person enter into hypoglycemic coma. The medications, those are changed by cytochrome P452D6, such as mitriptyline, clozapine, codeine, desipramine, fentanyl, plikenide, fluoxetine, meperidine, etc. Ginseng initiates or stimulates the breakdown of these drugs. So the dose should be increased or concomitant administration should be avoided. Next drug is turmeric, which is very commonly used in India as well as Indian subcontinent as spice. It consists of dried rhizomes of Curcuma longa belonging to family Zinziberaceae. The major chemical constituents are curcumin, dimethoxycurcumin, and bis-dimethoxycurcumin. Generally, it is applied as a flavoring agent, anti-cancer agent in treatment, in certain cosmetics, antiseptic, antioxidant, anti-helminthic, and as an anticoagulant drug. There are certain toxicities associated with turmeric which have been recently observed, like gastroesophageal reflux disease or disorder (GERD), wherein the contents of the stomach, they bounce back into the esophagus, and since these contents are mixed with the GI acids, so it causes heartburn. Overconsumption of this curcumin or the turmeric can aggravate the GERD disease. It reduces the iron absorption and leads to anemia in patients whose hemoglobin content has been reduced. It increases the bioavailability of most of the drugs. Now, unintentional increase in the bioavailability can cause severe side effects or toxicities associated with the particular drug. Overconsumption, oral overconsumption of turmeric can prolong bleeding. Normally we have seen that turmeric is applied during bleeding, but it is on open cuts and wounds. But if you are consuming turmeric orally, then it prevents platelet aggregation and it can prolong the bleeding time. Therefore, should be cautiously used in patients suffering from gallbladder problems because it aggravates the cystine or gallstone formation. It also aggravates the bleeding problems, and persons who are sensitive to hormonal conditions wherein certain individuals such as suffering from breast cancer, uterine cancer or ovarian and endometriosis or uterine fibroids. In these patients, the curcumin, the chief component of the turmeric, has been found to make these patients more sensitive for hormonal changes. So it can aggravate these situations. Now, many a times you might have seen that turmeric has also been effectively used in the treatment of breast cancer or uterine or ovarian cancer. But the mode of administration is different. And here, if you are consuming curcumin orally, these are the problems that can happen. Although turmeric does not interact with most of the drugs, it is rarely found to have a major drug interaction with anticoagulants or antiplatelet aggregators such as aspirin, warfarin, clopidogrel, or heparin. So, it exhibits synergistic effect with these drugs and prevents the aggregation of platelet and prolongs the bleeding time. So turmeric should not be administered in patients who are about to undergo surgery or in pregnant ladies whom due date is near. So because it can prolong the postpartum hemorrhage.